Welcome and hello everyone. My name is Gauravi. I'm based out of Atlanta, Georgia and practicing as a board certified classical homeopath in United States and one of the board member of Council for Homeopathy certification. So guys, let's talk about HomeoEd. HomeoEd is an app that aims to provide resource and courses on homeopathy for undergraduate which cover all the NCH course and university syllabus including test series. We are so passionate and committed to provide best homeopathic education resource and make them available at fingertip. Join us on this exciting journey together. Let's shape a brighter future with HomeoEd. Rashmi, do you want to share something about HomeoEd?
First of all, thank you so much, Gauravi, for being there in the middle of night from Atlanta. Thank you so much, and big cheers to you for being there for us and the purpose.
No, it's
Thank you
my
so much, first of all, Gauravi. And फर्स्ट ऑफ ऑल शुरुआत तो नेचुरली उस चीज से होनी चाहिए जिस चीज के लिए आज हम जमा हुए हैं, दैट इज आर वेरी डियर जसवंत सर. So Gauri, if you finish his introduction as well, then I'll
Okay, sure.
sum up everything.
Yeah. So let's start with Dr. Jaswant Patil. Okay, so let me cover this. Firstly, initially, we have the first webinar with Dr. Bagal sir, Dean of Faculty of Homeopathy, MUHS Nashik. Second webinar with was renowned pediatrician Dr. Dev Pujari on homeostasis, the soul of physiology. And today is the medical webinar on practical approach of clinical homeopathy prescribing. It is my pleasure to introduce our legend keynote speaker, Dr. Jaswant Patil, with more than 35 years of experience as a renowned cardiologist as well as celebrated, reputed homeopath, researcher, speaker, teacher, and practicing physician with over 35 years of experience. He was lecturer in KEM Hospital, Mumbai, mentor and guide at Hanuman College of Homeopathy, UK, founder and chief visionary at Deep Ganga Group. He is a trained cardiologist, chest disease specialist. His professional life has been about introducing integrated treatment protocol using homeopathy, allopathy, and other alternative therapies for providing holistic treatment. Recently appointed by Government of Maharashtra on Ayush Task Force Committee on 2nd May 2020 to advise government on the problem of COVID-19 prevention and experience. He believed that disturbed mind is the root cause of all the disease. Very well said, sir. I totally believe in that. He has successfully treated many chronic cases like cancer, tuberculosis, asthma, kidney failure, arthritis, diabetes, heart disease, neurological disease, and digestive disease. Homeopathy treat disturbed mind, thereby disturb immunology and physiology start functioning normally and disease get eradicated. Homeopathy gives you power to recover yourself. He brings a wealth of expertise to our discussion. They have made significant contribution and have been recognized for their groundbreaking research. Please join me in giving a warm welcome to Dr. Jaswant Patil as they share their insight on practical approach of clinical homeopathic prescribing. Let's get started. Dr. Jaswant Patil, can I have you? Or Rashmi, do you have some words to go over?
I have lots of words to say
Sure.
right now.
Uh-huh.
Thank you, Gauravi, for this wonderful introduction of the wonder man of homeopathy, is what I call him. रश्मि कहीं जो खुद जल कर तपा है, जो खुद जल कर तपा है, उसे हम या तुम क्या रोशन करेंगे? जो खुद जल कर तपा है, उसे तुम और हम क्या रोशन करेंगे? जिसने अपनी जीविका और जीवन भी होम्योपैथी के लिए दांव पर लगाया, उसका हम और आप क्या इंट्रोडक्शन करेंगे? So, started as a skeptic just like Kent, converted to homeopath just like Hahnemann, mastered materia medica just like Herring, practicing homeopathy in most clinico-pathological way just like Boric and Boger. इन सबको जोड़े तो आज की डेट में an idol that join together and one name emerges, one personality emerges, that is Dr. Jaswant Patil sir. He is humble enough to call himself, he is a still learner and growing with the experience and knowledge. But for us, you are already been there, sir. You have already been there. Now, बात करते हैं कि ये तो बस शुरुआत है. शुरुआत हमेशा एक पॉइंट से शुरू होती है, डॉट से शुरू होती है. ये तो बस शुरुआत है होम्यो एड की हर फैकल्टी, चाहे bestseller faculty we do have like Nagendra Babu sir, who has been rocking organ all through. जैसे डॉक्टर दास सर का क्रेज था, वैसे ही आज नागेंद्र बाबू सर का क्रेज है. So Nagendra Babu, who is there to teach us organ, we have another faculty who is author of FMC book, Dr. Ruchi Biswa, Dr. Pushpa Sharma. We have many MBBS also to take over the allied part, because we always lack in that clinical side of the thing or diagnostic side of the thing. So गए वो दिन जब कभी स्केपिज्म के लिए कहा जाता था कि होम्योपैथी में डायग्नोसिस की जरूरत नहीं है. अभी सर से बात करेंगे तो हमें पता चलेगा कि डायग्नोसिस इज सो इम्पोर्टेंट. और क्यों है वो भी सर बताएंगे आपको. हमारे पास में लुधियाना से, पंजाब से, साउथ से, जयपुर से, we have got so many faculties. You all can see very well in our app. Basically इन सब का एक ही वादा है और इन सब का एक ही कमिटमेंट है. हमारी फैकल्टी इतनी कॉन्फिडेंट है. रिसेंटली आई हैड टू स्पीक विद वी कीप ऑन टॉकिंग. तो हमारी फैकल्टी ने, मैंने कहा कि सर क्वेश्चंस को हम कंट्रोल करें क्या, आप बहुत बिजी रहते हैं तो हम क्वेश्चंस को कंट्रोल करें क्या. हमारी फैकल्टी कहती है, शी वाज अ लेडी एंड शी सेज कि मैडम क्या ही पूछ लेंगे, ऐसे कितने डाउट्स होंगे, उनके जितने डाउट्स नहीं होंगे उतने जवाब है हमारे पास. ये है हमारी फैकल्टी, डेडिकेटेड एंड कमिटेड टू अपग्रेड एंड एम्पावर योर नॉलेज ऑल थ्रू. Homeo Ed basically committed to learn from legend. ऐसे ही लेजेंड आज हमारे वेबिनार में आए हुए हैं और इनको सुनने के अलावा there will be many more benefits. We can see benefits constantly popping in for us also, for you also. उसको भी मैं आपको आखिरी में शेयर करूंगी कि आप ये पूरा वेबिनार सुनने के आपको और क्या क्या बेनिफिट्स होंगे अपार्ट फ्रॉम नॉलेज एम्पावरमेंट. So first of all, I expect Jaswant sir to start with, because we are dying to listen to you. First of all, I want you to share that first journey when you, because very rarely I've heard him sharing this, but he was skeptical about homeopathy. So we wanted to know and understand why he was skeptical, so that we understand those are the loopholes that we need to seal. तो वो हमारे लिए एक टारगेट होगा जो सर को चैलेंज लगा. why sir being an allopath was skeptic to homeopathy. So first of all, I want you to share that thing. Meanwhile, we are receiving the questions. We will share with you, sir, and you would be answering it consequently. So over to you, Jaswant sir.
Good morning, all friends. Thank you, Rashmi and Gauravi, for introducing me briefly but very nicely. But today is a time that Rashmi told me, sir, you have a PPT presentation. I said, PPT presentation is not to be put in the beginning because you talk stereotyped. So that the best thing would be to question and answers. There are so many questions at every webinar people want to ask me. Time is a constraint and I cannot answer them. My journey started as an allopath first, MBBS from Grant Medical College, JJ, Mumbai. And I was not knowing homeopathy ABC about. I had never heard of it. I became an MBBS doctor. After that, I joined KM Hospital as a pulmonologist for MD. And in MD, there was a time in between getting admission to MD pulmonology. So in between, there was about a year because I wanted the branch and I was not getting it because that time there was different rules. Same college, same student will get post-graduation. So chances, and JJ Hospital had only tuberculosis. It was not a chest disease. So I thought that I can wait because whatever is there in your mind to achieve that mission, even if you have to wait, you should wait. That is what I learned. And in that 1 year's time, I first joined my Harkishan Das Hospital. It was a medical post, general medicine and cardiology. And in cardiology, there are different types of patients, ICU, everything was there. But I was posted to mainly on the, because I was a fresher, so it was just for a house post. And while doing that, first day when I got a call, patient is serious. Doctor, please come urgently. And I had all my theory in the mind, no practical experience. Because even in MBBS time, the practical experience that was taught, patient is brought and teacher is teaching you, but you really don't learn by that. That is what I said. I was standing next to a dead patient and I was not knowing how to start, where to start, what to do. Read everything in theory, but when it comes to practical, your heart is racing, you are with palpitations and trembling and everything. I think that happens with most of the students when they join practically that. And sister started saying, this doctor doesn't know anything. So she called a senior and I felt ashamed. I said, what is this? What is a no? Means it was so frustrating that I said, I want to commit suicide. I can't be a doctor like this. My passion was a doctor, right? I do not know. From the time I started understanding, everyone asked me, my only passion was to become a doctor. Just to cure the sick and bring happiness in the families. So with that passion I had entered, means I have prayed to Siddhivinayak temple when I was in 12th standard. That time the competition was great tough and only one chance in a life. If you don't secure mark in 12th standard, you are out from the medical race forever. No chance of second appearance. I said, God, if you can't make me a doctor, give me death. I don't want to be on this earth without a doctor. That was my passion and commitment for medical field. So I was a staunch doctor. Telling you the story, I went to Harkishan Das, where I was working as a houseman, felt ashamed and that. And then I started going to the ICU. What students has to learn, to learn the practical. Wherever I used to get time, no movies, nothing, no time pass in the life. I used to go to ICU, sit there. I used to help them and just observe what they are doing when the heart arrests. And doing that procedures, learned all the procedure by just observing. I used to tell them, give me some cardiac pumping. So no one is to give me. But you can learn by observing. And I learned by observing. And then I just made in my mind, if something happens like this, I have to start with this 1, 2, 3, 4, 5. Therefore, practical experience actually is very important. I'm talking this because students are also listening and how they should be there. Then I started taking a round, and at one place, from other doctors, a patient had a cardiac arrest, and I was filling up form at night for tomorrow's orders. And sister said, he has arrested. Please do something. His doctor is not traceable. That time there was no communication except for writing and sending the message. So I said, okay. I just remembered my procedure that I had seen in ICU. And I started doing that. God had given me a chance there. It was a very nice experience putting an endotracheal tube. I had never put, but I had observed it so keenly what they are doing. And I could pass in the endotracheal tube, give cardiac thumping and everything, and patient survived. So that day I said, yeah, now today I am a doctor. And that the happiness on the relatives' face made me a strong doctor all the more. Then I started going, after your work is over, everyone wants to relax, enjoy. There was a marine drive next, just 10 minutes from walking distance. But I never remember I had gone there except for 1 or 2 times in the 6 months post. Only studying and concentrating on the practice. So from there, cardiology was there with Dr. Soneji, and medicine and cardiology, I got a training, and suddenly I got a call from KM hospital that because there was no other student left, and then the seat was given. So I got admission into pulmonology. It was Dr. S.R. Kamath, the world's best pulmonary center. Means he has written books, he has framed all the respiratory findings and everything. He was a very well-known figure all over the world, and I became his favorite student. I'm managing IRCU, ICU, ICCU. And before that, since there was a house post not there in the chest, so they said you will be taken up for the house post in respiratory for 6 months. So again, I had to join a department of same KM hospital medicine department. There I got a very good teachers, Dr. Farooq Dastoor, and hematology, Dr. Mehta. He was the best. So I used to do slide and do everything. So, the training was so hard. The start is to start at 5 a.m. in the morning and end till 2 a.m. next day. So almost only one time meal was there. That was pav bhaji for 4 years. Now I cannot see pav bhaji. It was so disgusting, but it was a really hard training. So, when we get a training like this, we become a hardcore allopaths. So all allopaths who are against homeopathy, I don't talk anything against them, because the training is like that. That training is so hard that makes you so perfect, so nice to handle all the situations. And then from there, I was giving chemotherapy to one of my patients, and he was a lung cancer. And while saying, he said, "I'm an astrologer. I can know anything." I said, "Tell me when you are going to die or whether you are going to survive." So he gave me the date, time, everything. I said, "Then why the hell you are making me do all this exercise? You know that certainly you are going to die, and I'm giving you chemotherapy, wasting your time, my time, and wasting money of your relatives." He said, "I got only 2 daughters. I know that surely I'm going to die, but I'm taking the treatment for their satisfaction, because they will feel something was done and then our father died." I said, "What a great sense this man has." So he formed my kundali. I say, "I don't believe in astrology." The staunch allopath, scientific man, doesn't want to listen to any other things. They feel everything is nonsense. He said, you will be the best allopath first, and then you will switch on to homeopathy." I said, "What is homeopathy? I never heard the word homeopathy till my MD. Huh? So what is homeopathy? बोले, सफेद सफेद गोलियां रहती है, ऐसी मीठी मीठी गोलियां. So what nonsense he's talking? And then I said, first line was that he had given me 3-page Bhavishyavani for me. But after reading that, yeah, what is this nonsense? I'm going to be an allopath, and this man is saying like this. So I just want to be out. I don't want to read the other thing. I was so staunch. And the homeopathy word was the first time that heard from that patient. Then after that, I was sitting in my OPDs. So patients started talking to me about homeopathy. When they used to talk about homeopathy, I used to say, "Why the hell you have come here? Go and take homeopathy, get well. Why you are coming to us?" And they used to get exacerbation, and that was not been managed by the homeopaths. So what Rashmi was telling me, what experience as an allopath, how patient comes to you. So what happens, now being an allopath, I have analyzed that particularly when you treat any chronic case or any case, when the acute phase comes, very acute phase, you retract. You don't treat confidently. There are no fixed protocols. You go by classical selections. So if your classical selection is right, patient will respond. But if it is not right, what is a guarantee that it will be right? That patient deteriorates. And when he deteriorates, he comes to allopathy. At that time, then I used to say, nonsense. If you take this medicines, show me your medicines. I used to put it in a dustbin, and don't come to us otherwise if you are going to take homeopathy. I was not knowing ABC of homeopathy that time. So what these small pills can do. We have got 500 milligrams, 1000 milligram doses. I was not knowing that it is a dynamic, it doesn't have medicines, but only small, seeing like every medicine looks the same. That was in my mind. So that was my very primary stage of my life, when I used to start saying nonsense about homeopathy without having sense about homeopathy. That happens. That was because of the strict training. And what I want to give a message to all homeopaths is that basically, my journey started as a clinical practitioner. in my own OPD, in my own nursing home at Jalgaon, when I switched over to homeopathy. How I switched, I'll tell you later. But giving one prescription of allopathy and one dose of homeopathy used to do wonders. And there, if the patient is in an acute phase, I used to manage by allopathy. And in that acute also, if it is not responding to allopathy, I used to add homeopathy dose and I used to get marvelous results. There are so many cases I can discuss. It will take days together to discuss all the cases, but my experiences are very wide. And I started seeing that my patients are getting so well. From 15-20 OPD of my patients per day, it increased to 150. And my indoor, which was 20 bedded, started going from 0 to 1. So it was very difficult to maintain indoor. I said, why people are not getting admitted? I was scratching my head. Why they are not getting admitted? Here OPD, so from the OPD cloud, patient usually gets admitted. So one of the patient of asthma, when he crossed me, and I saw, if he was with me for 5 years, and I was seeing that in 5 years' time, you every year used to get admitted 2 or 3 times. When the seasons change, you go into acute exacerbation, and you never required an admission. I said, why this happened? So I asked, what made you good? You give that water. That is a magic water. I used to feel ashamed to give homeopathic pills. I'm very honest to you, because even though I started liking homeopathy, but it was I used to feel inferior of giving these homeopathic pills to start with initially. Now I am very proud of giving homeopathy. I can say I am an homeopath rather than an allopath. And then that patient told me that this liquid, that is a magic liquid. As soon as I drink it, I go down your hospital. It was on first floor. My chest gets cleared. And I feel as if something has gone out from my body. That particular word fixed in my ears and mind, that this homeopathic pills are doing magic. And literally, I had to shut down my indoor. Only ICU was there and step down ICU was there. This particular, my experience of homeopathy that I have shared with you has brought me immense belief, and the magical results had given me good name and fame in all of my area. That's what I want to share with you today. If you have any question, I hope you understood. Time is short, so I have to be very short in discussing. Thank you.
Thank you so much, sir. Definitely, we have received so many questions. The first question is that we most of the time face, being a homeopathist, कई बार patients consult and visit so many people, and कई बार even homeopath से भी maltreated case होके आ जाती है, what we call maltreated, कि which was treated often with various allopathy हो गया, ayurvedi हो गया, homeopathy भी हो गया, and फिर भी वो recover नहीं होती है. So that is called as a maltreated case. So whenever this kind of maltreated case come across, how to start, and specifically when you don't know the name of homeopathy medicines as well, so how to start, please guide.
See, this was a what question who has asked. Has this question had haunted me when I started practicing in homeopathy. My practice approach was first just a clinical approach as per the diagnosis. Then there was a case against me in police station, that how a allopath is practicing homeopathy. But I told them that I have employed an homeopath. Every allopathic hospital, everyone employs homeopathy doctor as an assistant. I have employed and he is giving it. I am not giving it. So that time I realized that I am getting, whenever you get such type of criticism or some problems in the life, God is telling through them that go and take admission into an homeopathic college. I took admission into homeopathic college, 4.5 years course. That time, first time I read about the principles of treatment, that is classical organon. Then I was seeing from first edition to sixth edition, there are so many changes. And sixth edition came very late after fifth edition. So Dr. Hahnemann also faced problems, and he had to change something. So the editions, they came more and more reformed, more and more reformed, more and more reformed. And the sixth edition ke baad mein, there was no edition. Okay. And this made me always thinking that even Dr. Hahnemann faced the problems in his life, and he was dared to be wise to change the things in every edition, finding new edition, the basic principles remaining same. What was that basic principle? Was mind is a sole generator of disturbed mind, not mind. Disturbed mind is a sole generator of all the diseases. Now, patients who used to come to me and they were taking allopathy, even I was giving allopathy, at the same time homeopathy. So I understood that giving homeopathy along with allopathy has not caused much of a problem, except when antis are used, like antibiotic, anti-inflammatory, anti-hyperacidity. So if they are curtailed down to a lowest minimum doses or kept as an SOS, like patient is having very hyper changes where you require an anti-action, and that time, otherwise they should not be given, they should be tapered off. If the infection is very high, the WBC count is more than 2200, 22,000 above, then you can introduce a short course of antibiotic along with homeopathy. This was my integrated practice right in the beginning. But after passing through all the BHMS exams, getting a degree, then I emerged as a classical homeopath. And classical homeopathy means then that you think only in one direction. Then I became a patient. I had a lot of problems for which I had been to various homeopaths. And everybody was prescribing me different medicines. They are all classical homeopaths. So I said, how can classical homeopathy, different medicines approached by different doctors, then how can you call this as a single remedy and single cure? That always haunted in my mind. Then what about the other homeopath has given this and I am taking now this, whether it is inimical, complementary, follows well. If it is there, then it is good. But if it is inimical, it is bad. But even then, I started experimenting myself. I said, always try to do. And when you experiment, you have to be very careful with that patient. Basically, when I have seen, that is my experience, when the heart is in a very good condition, nothing goes wrong because patient never loses life. He may suffer, but he comes back to normal. That happens even in allopathy. We are not gods. Okay. So I said, instead of experimenting on patients, why not experiment on yourself or your family members? Because you are there with them for 24 hours, 48 hours, 72 hours. You can sit with them if they are into a problem. So first I chose myself to self-medicate and see, take different type of medicine, what helps, what this helps. If I mix the medicine, not at one time, but placing them at a different intervals, then I started thinking this, why this repertory has got follows well, complementary medicines, similar medicines, inimical medicines. So I was thinking why these categories have been made when you have to give single medicine and patient gets well all throughout the life. That never happens, that I have seen. And therefore, there is always a change. And then I said, I should not be very rigid about everything. Dare to be wise. When the case comes, what type of case comes? Now he's been given medicines by 5 different homeopaths, 5 different allopaths. The spoiled case, I don't believe in this spoiled case, because I have seen even in such cases when exact similimum or partially near partial similimum medicines are being given, they start showing the response, and at one time a single peculiar queer symptom comes up, and that tells you this is a medicine. And just you give that medicine and patient gets well, and he fares so well that I'm surprised, and he gets well by the Hering's law of cure. Either he will get cold, he will get skin eruptions, or he'll get diarrhea or tooth problems. I remember tooth problem. and hair fall also. Hair fall also. This I used to say कि medicine डॉक्टर साहब होम्योपैथी खाने के बाद हेयर फॉल होता है. ऐसा कुछ नहीं होता है. But if you really see the hair, tooth, these are exteriorizations. Okay. And the fall of hair is replacement of the bad hair by good hair. That always happens. That I have seen. So you should not be afraid. Tooth problem, he goes to a dentist, again spoils the case. Skin problem, he goes to dermatologist, again spoils the case. Because they do not know that they are treating exteriorization symptoms, and that will go to the interior to cause more of the damage and more of the problems. So if when you are giving medications, you have to place one medicine at a time and see the response. That response can be seen in few hours, not 7 days. Because 7 days, the patient is lost. He will get into a problem and he will go to another doctor. And no one is going to, even if you get a problem, honestly speaking, so many homeopaths have taken vaccination when they know that vaccine is bad. I have not taken. I was damn sure vaccine is not good at all.
Wow.
Vaccine is not good at all. And I placed on my Facebook also. But suddenly in few hours, my Facebook got blocked and it was banned for 1 month. But I was vocal enough to say what truth I had seen, because it was a DNA vaccine and people are dying today. I told Lokmat that please put this news so that we can save so many lives. Sir, we can't say put like this news there. I said, okay, you have any proof? I said, I got my own observations, what I am seeing. So say, no, sir, this is not correct. We will not do anything like this because government will take action against you also and me also. So speaking truth is also a problem. But I said, whatever will happen, will happen. Let us see first. We have to save the lives just to save myself. I cannot put a threat to the other's life. So I was waiting. I'm always from morning 3 o'clock or 4 o'clock, I get up. I'm always on the net, finding out researches. What are the new developments in allopathy? What are the everything? How researches are going on? Sometimes I visit even the research gate of homeopathy, see how they are doing, what they are doing. So from there, I got one article that was in New England Journal of Medicine. 19 patients were seen after vaccination. They showed sudden deterioration into them. And what was observed in them was thrombosis, hemorrhages, nerve problems, encephalitis, or GP syndromes, or autoimmune diseases. Because, whenever the vaccination given, has anybody checked what are the antibodies that are increasing in your body? No one checks that. No one checks. But then I said there must be something in this particular New England Journal of Studies. It was platelet 4 antibodies. Platelet 4 factor antibodies was there. So now what was a platelet 4 antibodies was causing these problems. So it has gone into autoimmune, destructing the platelets. So thrombosis and all this will come. But I inquired with the laboratory, can we do this for all the patients? But it's so costly, we can't afford it. Then I started doing antibodies for IgG antibodies, IgM antibodies for COVID-19, SARS-2 COVID-19 antibodies. But even there was not much of a difference. Then I said, why this is happening? Why this is happening? Then suddenly the one test came, because I was always in search. How can I find my patient is at stake or not after vaccination? I said, I got a clue, and then finally I came. SARS-2 COVID-19 spike protein, total spike protein, not only spike protein, total. They give cutoff value. No, ask them for a total. So SARS-2 COVID-19 spike protein, total IgG, only IgG antibodies. And the number astonished me. It was 15,000, 20,000 infant patients, 60,000, and they were all suffering from the diseases. Now, even if you give a constitutional treatment for them, by classical methods, they were not responding. Then I added, what is a pathology? Pathology is coagulation. Okay, so what will be the remedies that are used for thrombosis and hemorrhage? The best was arnica. It covers everything. So best was arnica. Then along with that, I said, why they are getting heart attacks? Now, how you can predict? I'm teaching my all dear homeopaths how I approach, and you should also start doing these techniques that will make you the best, and you will be in a roaring practice, as well as the homeopathy name will come up. All homeopaths should share their knowledge with each other. If I have understood something, I'll keep it to myself because my practice should not suffer. That is a wrong attitude. When the homeopathy grows, a homeopath grows. And when homeopathy will grow, when homeopaths who are getting good results, understanding, and they are sharing the knowledge with other students or other colleagues, and they start practicing and they start getting the results, the image of homeopathy will rise. And that, if the image of homeopathy rises, naturally your practice will not decrease, your practice will increase. And people will start believing. So, these antibodies was one thing that I discovered. Oh, this is things. And what are the remedies for that? Then second, I discovered was how to know that person is getting affected at heart level. Who is prone to get an heart attack? Have you ever thought of that? Hardly someone thinks of that. Might people must not. But I understood that this particular HS, that is highly specific CRP, C-reactive protein, that rises, and it shows more of an cardiac involvement. More of an cardiac involvement. If the patient is breathless, do these tests that will guide us the high level of HSCRP along with raised antibodies. This man is at the risk of getting sudden heart attacks, whether he is young, whether he is military man, whether he is sportsman, he is going to get it, because you have played with the nature by giving DNA vaccination. And therefore, now we are not against vaccination because it has protective effect also. But at the what cost of somebody? See, what was the death rate in COVID was 2.2, and after vaccination it was 8. It was not declared. In some studies it is there. So what is the use? Dr. Hahnemann also left his allopathic practice because people were dying more by the treatment than by the disease. And now the ICMR has started doing the research to see really what vaccination studies. And I tell you, vaccination effects remains intensively for first 5 years of vaccination. Then second, it remains for up to 11 years. So till 11 years, you are going to find certain, every time in a group messages, somebody dies, I have to write the message RIP, RIP, RIP. So why so much message? I never put in this message. I stopped seeing, I was getting frustrated. So now when I got this IgG, spike protein antibodies, and HSCRP, the approach was arnica, giving Crataegus G6C, Cactus G6C. And then the medicine that is classical, which fits into the other problems. If it has got other pathological problems, other pathological remedies can be fixed in at the 1 day interval, 2 day interval, 4 hours interval, 1 hour interval, depending on the severity of the disease. And I have studied. If you see I have kept my case papers right from 1992 when I opened up my nursing home till today. And all record is there. I go and see my old records. I was a clinical homeopath, then a classical homeopath, and now integrative homeopath and clinico-pathological homeopath. So I've gone through all the stages. And while going through homeopathy, like all students, all doctors are getting confused. Nobody is in a sure short way saying what potency to give, when to repeat, when not to repeat. There are fixed guidelines. But when you go by that, always it doesn't fall true. And the protocols has to be set in. Why allopathy is number one? See, allopathy is the best science. I always say allopathy is my father's science and homeopathy is my mother's science. So that science is also good, but the way it is again practiced by many allopaths, that has put again bad reputation to allopathy. But when I was practicing, and all good teachers, I was lucky to get good teachers. So you should be lucky to get good teachers Then only you be a good doctor and analyze. In KM Hospital in JJ, topmost teachers I had seen, I was keen on observation and thinking and asking them foolish questions. I used to ask, sir, every disease when we write, first cause of disease is idiopathic. I said, sir, what is this idiopathic? I'm an idiot, I don't understand. What is this idiopathic? My teacher said, don't ask foolish questions. Idiopathic means go and search dictionary. That time Google was not there. So go and search dictionary. Idiopathic means no one knows. And that question kept me haunting till the time I discovered homeopathy. And what is that? Disturbed mind. Disturbed mind is the first cause. And every allopath writes in the books, in the answer paper, while giving exams. What is the first cause? Everyone blindly says, ek to mujhe malum hai, idiopathic. That is no one knows. So that was a beauty of, allopathy when combined with homeopathy, gathering the knowledge. And both are, see, basically, it is like allopathy and homeopathy is step brothers. Okay, step brothers. Father is one, but they are step brothers. So, and the fight will go on right from Dr. Hanneman's time, and it will go on and on till the time the homeopathy importance comes in the mind of allopath. And that is, I said that what to do. Then I said, I should start. Allopaths used to come to me. They say, you are an ENT surgeon, do one thing. I'm treating you, but you'll have to do one favor for me. And that will help you increase your practice. If you are getting very sticky cough problems, that cough is not, you're giving guafenicin, you're giving Chimoral Fort and everything. Instead of give one Kali Beach 200. एक इतना ही लेके जा, मैं मेरी तरफ से देता हूँ. और मुझे, अरे जसवंत बहुत अच्छा रिजल्ट है आपने इसके साथ. Patient just 7 days हम cough syrup बदलते थे. Even then they were not getting well, and one dose. मैंने कहा criteria is that it should be a sticky sputum. Sticky, very difficult to detach. Chalo. And then they started saying, homeopathy works. So, there was a dentist. I said, you give combiflam after dental extraction, or when you put the braces, patient gets a pain. Give belladonna 30. What is belladonna? Is initial congestion pain. So he started doing that and he got a result. I said, now what we'll do a research on this. He was kind enough to do a research. I said, put your name as first and my name as second. I will guide you, but we will put up a research. And he had done a research and it has been published in the Journal of Homeopathy. How a combination of allopathy, that dentistry, and without giving any anti-inflammatory, without giving any antibiotic, by putting calendula after tooth extraction, the healing process, everything is best. He said, these are giving marvelous results. Now, one more favor you do. You tell to your other colleagues who are ready. You see, I'm getting results. That is how you can inculcate the knowledge into your colleague homeopaths. We are all same. We both are doctors, allopathy also and homeopathy also. We should not fight. We should not criticize each other. Every science has got scope and limitations, Now, what should be our mission? Only one, that Dr. Hanneman has said. The mission of physician is to cure the sick by whatever ways you want. And therefore, he had put so many things in footnotes. He used to advise some ancillary treatments and some alternative treatments also in the footnotes, if you see in the canon. So he was wide open. Then while giving so many remedies, I was getting a lot of criticism also from our colleague homeopaths. I said, see, look here, my dear, my mission is to cure the sick. I am not for homeopathy, I am not for allopathy, I am not for Ayurveda, but whatever is good in every sciences, I should see my patient is getting well. And there was a fear, if you do this, the patient will deteriorate, he will go into this disease. That doesn't happen. I'll quote one example. One collector of Jalgaon was coming to me for a treatment. His mother had a knee problem, so severe knee problems. So I gave her homeopathy. The knee problem vanished, but then eczema appeared. Now I said, now I was so happy. Was Dr. Saab, she is not sleeping all night and this is causing problem. I said, see, look here, if you do this, this patient will go into a problems, and then she will have an heart problem, that problem, internalization of disease. He said, but doctor, her life is at very great discomfort. So I used to give her some medicines to take care of itching by single remedy. It failed, and finally she switched on to allopathy, and that eczema got well. So I was furious. I said, you have done wrong thing. Now your mother will suffer from so many problems. This. And I followed that patient for about 12 years later. He got transferred to another. So how is your mummy? How is your mummy? I was always feeling something must have. She is hale and hearty and fine, doctor, now. That knee pain is also gone, skin disease also gone. And nothing bad happened. I said, then why the bloody I am in phobia all the time? I have done wrong. I have done wrong. It happens. Then I realized, if you read organ, a layer-wise disease comes. Final SORA, when you treat SORA, you'll get psychosis. Then you treat psychosis, you'll get. So if there is nothing inside left, why the things will come up? So again, I started scratching my head, because what you read, what you learn from different teachers, from books, from material, and everywhere there is so confusing written in homeopathy. There is no protocol, no fixed dictums. So it used to make me miserable and frustrated in giving treatments. So this is how I arrived at different types of things and different type of things when the mission is just to cure the sick. Next question.
Next question is mine only. Wonderful elaboration of, because it is the biggest challenge, and I think major chunk of this our practice is going to have this kind of cases only, what we call maltreated cases. क्योंकि first step में आज भी वो mentality नहीं है कि first step में you get a disease, let it be acute, chronic or anything, they will come first to homeopath. We have got hardly 10 to 15% of patients of this sort. Mostly they will go to other pathies, get not relieved, not cured, get worse. Maltreated is what we will finally coin them, and then they will come to us. So that is the universal thing. You spoke very wonderful thing throughout. The most favorite part was कि allopathic science is your father, and exactly like father figure, it is principled, goes by rules, strict, not bendable, and just like father. And when it comes to homeopathy, it is motherly, artistic, ready to flex, customized, individualized approach, flexible. So that is something I really loved, and that's why I'm quoting it very happily, that this is something really good. And just like for a child, you'd require both the balances. Either father should also, rearing and having some quality of mother, and mother should also adopt some quality of father, and perfect harmony can come. Then abhi kya ho raha hai ki abhi both are sitting at the extreme. So child is confused, यानी child is patient, he is confused. तो अभी वो जब उसको बहुत ही प्रिंसिपल जरूरत होती है रूल के हिसाब से चलने की, तो फादर एंड एलोपैथी के पास चला जाता है. जब उसको जरूरत होती है कि नहीं अभी मुझे पर्सनल केयर चाहिए, तो होम्योपैथी के पास चला जाता है. सो वी कैन हार्मोनाइज द टू पैथीज सो दैट द फैमिली ऑफ दीज टू पैथीज एंड चाइल्ड बिकम्स परफेक्टली हार्मोनाइज. सर फिर भी आपका ये जो आपने एक अच्छा सा एलेबोरेशन ऑल ओवर दिया, यहाँ पे फिर भी मेरा एक क्वेश्चन बचता है कि क्या ऐसा वो एक काम करेंगे so that we get that standardized approach, because I know homeopathy is highly individualized and that's the thing that makes it tough to learn and practice. और आज का विषय यही है कि clinical application of homeopathic knowledge. होम्योपैथ का भी है कि if you see the logo, one side there is a book, another side there is globules का vial, and both are shaking hands. Means क्लिनिक थ्योरी एंड प्रैक्टिस को कैसे हम जोड़ना चाहेंगे, एंड दिस इज व्हाट ब्रिजिंग वर्क होम्योपैथी इज डूइंग. दैट थ्योरी भी और हम सिखा रहे हैं और क्लिनिकल एप्लीकेशन भी सिखा रहे हैं. तो क्या ऐसा वो एक काम करे? व्हाट इज दैट वन थिंग? दिस इज माय क्वेश्चन. व्हाट इज दैट वन थिंग that we should be accomplishing so that there is a standard approach defined? I know it is difficult, maybe impossible, appearing impossible right now, but what is that standard way to approach these kind of maltreated cases? Just answer.
Yeah. Rashmi, you had asked me this question earlier also. I elaborated, but I think it is not
1.2.
standard. Now I come to the specific of maltreated. There is no maltreated cases. Body is so adaptive. People have drank poison and they are doing fine. Even the poisoning cases you say later on, so they are doing fine. Okay. Only what is required is a right remedy. No doubt, classical way of approach is the best, but it is the most difficult. If you send one patient to 10 classical homeopaths, 10 different remedies come. Then who is right and who is wrong? A study should be done by, I'm going to ask CCRH, ऐसे study karo. And what is classical? Classical means what is the meaning of classical? Also, many homeopaths don't know what is classical. So classical means what was formed by Dr. Hahnemann, the way of approach, the way of giving treatments by single remedy, observing. So 200 years back, scenario was different, and 200 after, today's scenario is different. Today's fast life. That time there was no communication, transport, no entertainment. People used to have time. Their mind was not so much polluted that time. Now here there are so many problems. Either jo affluent people, income tax problem, GST problem, government problem, this permission, that permission, then children education, costly, this. So your mind is all polluted. That was not 200 years back. Okay. So we must change as per the time and we must adapt to the new things, find out new things where Dr. Hahnemann has left. From there till here, we have come. And we always talk in this homeopathy, maltreated. No, they are treated. They are not mal. Who says that if you treat and patient goes to allopathy, he says this is maltreated. No, you have treated properly by whatever knowledge you have. What allopaths treat, not all of them get bad. With allopathy also, there are so many things. So 80% of population is to follow allopathy. We have seen my grandfather was totally on allopathy till the age of 86 of his life. So was he maltreated? No, he was doing well with allopathy. His cancer was there, detected, gone from the larynx. He stopped smoking. He had so many problems. At the end, he had a skin disease. So you see, the Hering's law came in him. I'm always going retrospectively. What has happened in my family? Correlate the knowledge of allopathy with homeopathy. So allopathy has not done any harm. So it is not maltreated by allopathy. It is been treated by the way that science has understood the means. So our approach should be, rather than contradicting and doing this, there is no maltreated case. Now, in this particular case, what was not treated, that you have to find out. And Dr. Hahnemann has very clearly said in the organon, a physician should know what is to be treated in the patient and what is a treatable in the remedy. So that match has to be done properly. Even this maltreated case, what we all say, or what allopaths also say about homeopathy, they get beautifully well. I can show you examples. There is one patient of COPD. He was treated with allopathy. Lot of steroids and pumps and antihistaminics and everything was given. Finally, he went into chronic obstructive pulmonary disease, which is irreversible. He came to me about 15 years back and has to give single dose remedy. He used to get well. He used to get well because it was in the initial stage, he was responding. Then after that, he stopped treatment from me. Again, he went to an allopathy because he was getting acute exacerbations. And now, again, after that gap, he has come to me. This case has taught me so much that I'm sharing with you. That what was my approach first was clinical approach, then a classical approach. And then after that, there was a gap. And when he came, then I said, you need this treatment. Now, he has got lung problem. He has got heart problem because of the COPD, cor pulmonale. So his heart is not functioning well. So everything taken together. And what is a mind disturbance? Any one single remedy doesn't fit in this. If you do a repertorization is very essential for every. I do a repertorization each and every case. First is always a repertorization, which is very important. You get some 20, 30 first remedies. From there, you find out which one is a pathological, which will go well, which is complementary, which is follows well, and then arrange the remedies. And then I given him. And there was a marvelous response in 7 days' time.
Wow.
Earlier, it was taking 2 months, 3 months, and so much maltreated case, as you say, that got so much a good response. And he says, doctor, you have done magic to me. You have given me a new life. Now I can run.
Oh.
This man says I can run, and my pumps and everything has gone. Earlier, it took so lot of time, and now this time, why that is so fast? So, this has taught. So, maltreated case se dimag se nikal do. Search for the proper rubric. You may not, what you say, maltreated or over-treated or treated by many. Rather than maltreated, we should treated by many. Should be the word, because no doctor maltreats any case. So, treated by many doctors, such type of cases, they do not have PQRS symptom. And therefore, we cannot arrive at proper remedy. Their nature changes, their behavior changes, everything changes. So even then, in this, you try to find out a classical remedy, because classical remains number one. I vouch for that, because when you get that is your trump medicine. But you may not get in all cases. You get confused how to start with. So go in a zigzag way till the time you get a classical remedy, and that clears the case. And this particular patient then started coming to me with more peculiar symptoms. रात को 3 बजे मेरा एग्रेवेशन होता है सर. पहले तो तू बता नहीं, पहले नहीं होता था, पता नहीं अभी बराबर 3 बजे की मुझे तकलीफ होती है. Give Kalikar, and patient got well fast एकदम. No, this Kalikar was not coming in the first hypertization. There were no clear-cut symptoms. That is what I want to share, that how to approach such cases is very important, and you have to go by these ways till the time. Don't get confused. I am giving this medicine, so I am maltreating. No. In first COVID time, when I lost my first case, I was sleepless throughout the night. I was feeling bad that why this has happened to me, when I had prescribed exactly as per the classical ways. Why this is happening? Why this is happening? Why this is happening? And then second case came, then I said nothing doing. I went by this what technique I told you, and within 24 hours that man was cleared. I said, wow, now this is not wrong. Then I tried on multiple patients. Oh, this is not wrong. And the results were marvelous. 90%, I would say, not 100%, 90% patients were all out and fine. And if they used to come with some PQRS, that medicine single remedy, case is closed. So in second COVID wave time, when I presented, I openly presented. If you give 10 remedies, say clearly on when you are presenting. You got result with one remedy, you say, I have given this and patient got well. How many remedies you have tried? You should be very honest and telling, because the students who are listening to you, you are not giving webinar, seminar for yourself. It is to teach the children, the students who are coming up, and those who are budding homeopaths. They should not be confused, because that will bring down the fame of homeopathy. So you should be honest. Even if you say, I have given this. I've seen them when asking the, sir, I had given these 3, 4, 5, 6 remedies. Only one worked, and that was presented. Like I cleared one prostate case with 285 PSA to 5 with 5 to 6 remedies. The metastasis was in lung, it was in bone, it was in brain. All that disappeared. And when I presented this case to a journal, they said, we will not publish this case because this has got multiple remedies. You write only one remedy, we will publish. I said, no, I don't want to speak lie. I don't want to speak lie. I went to USA. My assistant was there. She got a call कि नहीं तुम ऐसा करो, तुम ये एक ही रेमेडी लिखो बोले, स्टैफिशिया ग्रिया ठीक हुआ है. मैंने कहा that is wrong ना, that is wrong. Staphylococcus I cannot do singularly all these things. I had given pathological remedies also. So you should be honest. Then only homeopathy will come up. You treat 10 cases, you get 2. So many cases I get. I don't say that I treat all 100 cases successfully. Even today, I cannot treat all 100 cases successfully. But you should be well enough. Otherwise, what students will say, no, this is only a cup of tea of Dr. Jaswant Patil. No. Jaswant Patil also has failures. And one should not, no doctor is 100% perfect. तो तुम अपना सच्चाई से करो. Do with your honesty, integrity, and not with any other intention, no bad intentions. And Dr. Hahnemann experimented throughout his life, changed and changed and changed and changed over. Finally, I was always feeling guilty after COVID time. कि result तो मिला, but I am not as per the principles, so I am doing something wrong. So guilt used to कि मैं किसी का नुकसान तो नहीं कर रहा हूँ. I used to pray, God, give me some wisdom. Am I doing right? Because I am seeing the results. But what has been taught is pinching me. I am feeling guilty. And finally, in the second wave, the whole protocol changed. So I didn't give a protocol in second wave. So one of the doctor who raised his hand and said, sir, at the end, you have not given us any protocol in the second wave. You only presented the cases. I said, yes, I have not given purposely. Why? Because I was criticized. No, sir, the same protocol we have used and thousands of people are got well. And because of this, then I said, no. So God gives the answer through some human being only. No, what you're doing is right. Go what your mind says, what your sense says. And look here, one thing, if the vital force is strong, nothing goes wrong. A doctor cannot kill any patient. Life and death is fixed. Life and death is fixed. If the death has to come, it has to come. You cannot kill. Even people consume poison. I'll tell you one case to vouch this. When I was an allopath, one patient came, I was on a night duty and he was with poisoning. So I treated, same organophosphorus poisoning was a common thing that time. He survived. Second, he tried, I don't remember, with something, and he came in same my duty, same patient. So then I treated him and he got well. He used to get angry and bugged with me. Why did you save me? Why did you? I don't want to live. I said, God has given you life, and when you are going to die, you are going to die. So then what he did, he did a Reiki of my duties.
Okay.
He did Reiki of my duties. And then he came to know on this day, this doctor is not on duty. Huh? And that day he jumped from a building to die, commit suicide. And in casualty, I was there that time. My duty was shifted. And I got a call ki the doctor is not there, you have to come for a duty. So the same fellow came. So he saw me. Luckily, he was not unconscious. He said, my God, this man is always there with me. So there I realized that death is death. I was not a savior. God was a savior. I was just a helper, not a savior. If I say I cured you, I gave you life, who are you? You are no one. You are a human being. It's all directed. Your conscience is good. Your soul is pure, and you are purely doing for something. You should never bother about anything, and you should fight. I have seen so many deaths also. I have seen so many lives bringing back to the life. That doesn't mean that I have done that. It was destined. So never be afraid of this life and death. Thank you.
Wow. Very, very enlightening. Once we cannot imagine that, things can be seen like this, because we often go under guilt if we fail to get a kind of result. We often go under guilt if we really not relieve the patient, and we keep on introspecting where we went wrong and all. But this is really awesome that, that insight is really good. Only thing is, you have to be aware of your content intent. कंटेंट तो बने बनाए हैं, वो अपने आप डेस्टिन से आ जाएंगे, बट इंटेंट बस आपके हाथ में है, उसको अच्छे से रखिए. I have got Dr. Maharshi also over in the room. So Dr. Maharshi, do you want to ask any question? You're there? You can unmute and ask the question if you want. Gauravi, have you received any questions?
Let me check on at my end.
Yeah. Till then, another question when it comes like, the flow of, multiply treated, my intent or understanding of maltreated was that when the case fails to relieve or improve or cure, despite of so many interventions of various pathies or one pathy. So any case which is undergone so many things but without really a result or relief in the patient is I suppose to be a maltreated. So here sir, जब भी patient आता है तो हमारे को एक बड़ा भी challenge ये भी अंडर सपोज इन लाइक आयुर्वेदा तो ठीक है, बट एलोपैथी स्ट्रीम से जब भी पेशेंट आता है, होम्योपैथी और आयुर्वेदा हमें पता है कि इंस्टेंटली बंद करना है और कोई मेजर विड्रॉल नहीं आएगा. लेकिन whenever the patient comes who had been consuming long terms of allopathic drugs, जैसे कि thyroid में suppose he is taking some thyroid and thyroid drugs, he is on antihypertensive, he is on anti-asthmatic, he is on anti-diabetic. So how to withdraw this? This is really a question. Is there any standard rule of withdrawing these medicines, or should we go? Means what is that navigation? The pointer how to withdraw the drug, because of course withdrawal is very important. So how to withdraw that allied drugs? Ayurveda or allopathy, homeopathy, to we can make out okay instantly band karna. But how to withdraw allopathy when patient comes to us?
This is a very, very important question you asked me. And this all homeopaths should know. I've seen this suddenly stopping all the medications. See, the person who is for a long term on allopathy, it is a strict control, like a spring which has been pressed. Okay, so the spring has to be held like this. And moment you release, it will bounce back. And that time homeopathy cannot handle. And patient goes worse or into a problem. So this proper integration is such a beautiful phrase, and it is so practical thing also that has to be done synergistically. And if that synergy is not there, then this case goes haywire. So I'll tell you, when I get a case for 2 weeks, 3 weeks, I say, don't stop any allopathic drugs. Don't stop any allopathic drug. Keep on taking. Here we are going to get less results. But he's taking allopathy, we are giving homeopathy, vital force is raised, again this has been duped. So this to and fro will come to one balance. Now, at the same time, whether it has come to balance, how you will judge? The ups and downs patient says, now I am little bit stable, at mind I'm cheerful, now my appetite has improved, generals have improved. So that is the first time you can start saying, now I can taper off allopathy. Second is by pathological testing, like in sugars. If he was having 3 anti-diabetic drugs and his blood sugar is maintained at say 130, 40, and it comes down to 100. So that means our medicines have worked. Then that is a time you have to always warn the diabetic patient that when you are in homeopathy, you may go into hypoglycemia. If that happens at night, patient can lose the life. The death has come and you are a treating doctor, you will get a blame. So, for that reason, you should always ask them to check post-dinner blood sugars. That is what I do. And when you do a post-blood sugar, they go down. So at night, hypoglycemia and liver glycolysis and fasting sugar is very high. And then you get confused what is happening. Therefore, investigative approach is very important. That is what I tell all the homeopaths, that please do investigations. We just take symptoms, treat the disease, and go to sleep. No, you have to be vigilant. As a doctor, you should be a complete doctor. Just not giving medicines is your role. So you have to understand the follow-up, do the investigations, see. Like if I'm treating a thyroid case, if the TSH is 40, 50, and when I start with homeopathy, and he comes to you when the allopathic doctor says, now from 50 you have to go to 100. So there I say, don't go to 100. Let it be at 50 L-troxin micrograms. I will give you homeopathy, and then after 15 days, we'll check what is the TSH. Even if it comes down by 5, I say our homeopathy is working. Still don't stop the L-troxin because it has just reduced by 5. Let it come down till the time you may get a hyperthyroidism symptoms, or if you do the blood test, it will show significant reduction Then you say that from 50 microgram, you make it, say 40 micrograms or 35 micrograms. Bit by bit, taper off and reduce till the time. Then after stopping, every 15 days, I check a TSH and see, oh, that is normal now. And then you take over. Similarly, for blood sugars, for heart, don't do that mistake, because heart doesn't give you time. It is only disease where time is not given. Homeopathy requires time, because the selection of remedy takes time. Otherwise, homeopathy is faster than allopathy. For example, I'll give my own case, how faster it is. I got a chest pain and with breathlessness. I was feeling suffocated, and I said, these are the symptoms of heart attack. Now what to do? So I took an ECG. I always have a pocket ECG in my pocket. I took a ECG and it showed early repolarization of the ST segment. So it can be normal, it can be in heart attack. So I said, nothing doing. It is no. I took Cactus G. I felt better. 6C. I felt better. Now what to do? Then I started having fear. It will go heart attack. I will die. Now what to do? With that, palpitations started coming. So I took Aconite 1M and palpitations settled down. And then I said, if it is an heart attack, and that too is happening at night time, so there has to be some remedy. If it is syphilitic, I'm going to die fast without time. So what is the left side remedy in Merck group is Merck IR 200, and I've started feeling much better. So I slept. My daughter is an allopath. So she says, Papa, we must do troponin test, TROP-T test, TROP-I, TROP-T, sab karenge. And you better, and this pocket ECG machine cannot be relied upon. I said, no, it is relied upon. So she took me to an nearby, my friend who is taking homeopathy from me. He's got a multi-specialty hospital. So he took my ECG. He says, ECG looks to be fairly well now. That might be that pocket ECG. No, the pocket ECG is not that bad. I can understand what is pocket ECG. Certain changes are there, but this ECG seems to be improved. So I said, don't worry, nothing. But no, we will do your TROP-I, TROP-T test. I said, okay, you do it. So the result came little late, 1 o'clock at night, and I was fast asleep. This daughter came to me. She just woke me up. She had put a message to my colleague of JJ MBBS time. He is a cardiac surgeon. Then my another colleague is a renowned cardiologist in Pune. So she put all the messages to my group. My dad is having, anyone is there, please guide me. Without my knowledge. So they all started calling at 4 o'clock, 5 o'clock. You just pull him down and take him to an ICU. He is going into problem because his TROP test is high. The test had come high. So don't take a risk, he will die at home. So she came and woke me up. I want to check your BP. They said, at least check his BP. He must be in the hypotension and sleeping. So my BP was up. So what happened, beta? No, Papa, you have to get admitted. I said, bloody, I'm well. I'm not having any symptoms. I worked for 5 years in ICU. I was in whole Cooper Hospital, 20 beds ICU in charge. That is intensive coronary care unit. I know that nothing will happen to me, and I am always afraid of this. So they started forcing me. I said, okay, I'll agree on one thing. You repeat my TROP-T test. TROP-I, TROP-T test karo tum wapas se. वो high आए तो I will, because you people are afraid, so I have to see that you are comfortable. So they, okay, all right. So 6 o'clock, that man came to take my blood, and it was an urgent basis. I had an privilege because the hospital owner was my patient. So he gave me test in 1.5 hours time, and he said, it's all normal. How can it be? The other test was abnormal, and this is within a few hours, it is normal. I said, now please let me sleep. You're relaxed. Send all this report to that. It was a misdiagnosis. I knew that it is a problem. So it came to my mind that definitely there is some cardiac problem with me. Okay. So then I thought, I think to be on a safer side, whether it was there or whether it was not there, how to confirm it? It is only by angiography. So I waited for 2 days at home, and then I said, "Chalo, theek hai." There is all people are guests. There are 8 allopaths in my extended family. Everyone was on the toe. That everyone loves me, so they say this man is too much into homeopathy. He doesn't care his life. I said, no, I care my life so much. I am most afraid, fearful person because I don't want to live life for myself, but so many people are there for mission to complete my mission. I have to leave. I can't pass away so easily. But then I decided, chalo, theek hai, now this, the ECG is normal, top I, top T, all the tests, blood test of cardiac infarction are normal. So now you take me to, I called my Pune mein jo hai, my sister's husband, he's an pediatric surgeon. I said, see, I am coming on एक शर्त. वहां आने के बाद bloody I don't want that you can't take homeopathy. I will do angiography, but I am going to be on homeopathy. And what medicines I will not like of allopathy, that I am not going to take. Are you ready on this shirt? And he is a commanding person there. He agreed to my consent. I said, okay, then I am coming. And I will do only angiography, angioplasty and all that I don't want. Then I went there, and then cardiologist was very cheerful and jovial. He said, तुम्हारा अगर कभी कुछ प्रॉब्लम निकला तो मैं तुमको पार्टी दूंगा, हाँ, सिंगल माल्ट पार्टी। एलोपैथी में सब चलता है। तो मैंने कहा नहीं तो फिर मैं दूंगा। मैंने कहा ठीक है। There he put in a dye. He put in a dye. Left was all clean, no blockages anywhere. And then he said, "Oh, surprising! At this age you don't have anything." I said, "Homeopathy is there, but there might be some problem. Do on the right." So he put in the right, and right whole main branch and everything was clear except for descending. There was at the distal end, there was 80% block. 80% was calcium, hard calcium block. So that might have been for so many years. My strong family history of heart disease, my mother, my father, my uncle, my aunt, and everyone had in this. So I was afraid, but seeing that all clear at that age of 63, I was happy. I said, no, homeopathy has done good to me. So while putting, he said, this is at distal end, and even if you don't put in the graft, it's okay, fine, we can leave this. This is not very significant. But while putting in the stent, I was always observing that screen. I was conscious what is happening. Bigeminy, one trigeminy came and immediately bigeminy, that rhythm disturbances. So I said, this can be a problem in the life. I can treat this, but it may take a time. There I was dare to be wise. And I said, no, you put a stent. But I want a stent where I don't want to take aspirin lifelong. Do you have that type of stent? Then put it. Otherwise, I will manage this. I don't want to go for stenting. Then he said, there is, but it will take time because no one uses, very costly also. So it took 45 minutes for that stent to arrive. So they were giving me heparin, everything. And in that, that particular stent was put in. He said, but you will have to take for 3 months. I said, okay, I agreed. Packed, done. 3 months I'll take anticoagulants. And then after that, I'm not going to take you have put this such a costly stent. I don't want to be on the. And finally, then I took it and I was in the step down ICU, and my whole bleeding started from nose, from mouth. My urine was just pure blood. I was afraid. They all got panicky. And I was also, means, because of so much of loss of blood and that particular procedure, that stress, my mind was not working. Aishwarya was nearby me. I told Aishwarya, I'm feeling nauseated. And then, She said, Papa, what to do? I said, that doctor came, they gave me protamine, this, the bleeding was not stopping. And finally, I said, now I got up. I have to think now of homeopathy. I said, Beta, I just remember one word. Bleeding with nausea is IPCAC. Give me IPCAC 200. One IPCAC 200 dose was put in. And suddenly the bleeding started coming down. First, this stopped. Then urine started. In the morning, all bleeding was over. The bleeding stopped completely. And that was, I said, come on, thank you. Ye ho gaya, wo ho gaya, wo ho gaya. There is another long story. I'll tell sometime else because it's taking a lot of time. But these are my experiences that I am sharing. You know, this is classical. Nausea with bleeding. Okay. Nausea with bleeding. The bleeding stops. You give IPCAC. Close eyes and give. Like septic fever with delirium. Stramonium 200 works. These are the single remedies. These are classical remedies. These are classical remedies. So it's not that this happens and then happens. Thank you.
Wow, what a wonderful experience. I mean, it's 3:05 here in the morning, but still I am feeling fresh. I'm so attached. कि आप जो भी बात कर रहे हो वो मैं सुन रही है. I'm totally sleepless right now. So it's my privilege to hear you. Definitely. Thank you so
I
much.
think
Yeah. Uh-huh.
it's very late for you there.
It's
Next
three
day you have to
It's
work.
almost.
but it's so interesting. Yeah, and so helpful. Yes. I really
So,
want
any questions, Gauravi and
uh,
Dr. Marci, if they have got?
no question from my end. We pretty much cover everything.
Dr. Marci? So, coming to just one last question, and then we will finish. What to do? There are two questions. Means you can cover what to do when there are contradictory symptoms at mental and physical plane. Means one time, in one case only body is matching and the mind is totally contradictory. कुछ और ही है उसमें. या फिर mind is fully matching but physical symptoms are not matching. If so, if it is so, then what to do? And second is, if total case is matching but its thermals are contradictory, then what to do? Like, how to navigate through the situation. Just
This
one
this
second.
this
This is the
uh,
last question.
this has haunted me many times. So what you are facing, I faced all these difficulties in my practical life, and I have come to a conclusion that if you have a radar program with you, I usually use radar, and you go on minusing from Hahnemann time to the full synthesis of present time. The remedies that were said thirsty or chilly and hot, they're again been put into the opposite side also with 1 mark. So this confusion, I said, why this? The पहले तो ये नहीं बोलते थे this is chilly. Now they say this can be hot also. There are two polarities, so everything terrorizing is going on. You do not know. But in Ayurveda, if you read, every plant has got, if plant kingdom, if you study, plant has got a properties. But many a times this can also be a chilly as well as hot, depending on what the circumstances are there. So if the strong symptoms are matching, I don't give importance to thermals and these all things. The first selection criteria is mind. Particularly, I would quote and just remember this, particularly ailments from you have to take first, number one. And that ailment which is matching the innate nature, that you give first and then give pathological remedies, then you will not get what you say that it is a maltreated, you will not get that problems. And that is what is my observation, and I have learned from that. Hope I have cleared.
Of course, sir, of course. So yes, it's worth listening to an experienced person than reading thousands of book. So we are trying to, through this kind of web series, we are trying to understand and learn from the tagline of Homeo. It is learn from legends. These legends, their words are just precious. They are priceless. And this is what we are trying to get to your kids. to you all students. And Jaswant sir, this is what, although the evolution of the project of Homeo Ed had been, as it has been evolving, you had been throughout with us, sometime connected, disconnected, but connected throughout that, because whatever question I, shortlisted to ask you had been the essentially your question. So, we have so many matchings. So,
Yes.
um, होम्यो एड, दिस इज व्हाट वी आर ट्राइंग टू टेक केयर ऑफ, कि बच्चे अगर होम्योपैथी सीख रहे हैं तो उसको समझे भी और उसको अप्लाई भी करें. सो व्हाट वी आर ट्राइंग हार्ड इज कि अभी हमने मेथडोलॉजी में एक बहुत ही मेजर चेंज लाया है. अभी 1 बजे की मीटिंग है फैकल्टीज की, तो मेथडोलॉजी में हमने एक मेजर चेंज लाया है. व्हाट वी आर ट्राइंग टू डू इज कि वी आर पिक अप अ क्लिनिकल केस, सपोज इट्स अ डर्मेटोलॉजी केस, डर्मेट की केस है. सो एनाटॉमी of dermatology, the anatomy teacher will be teaching, physiology will be taught, pathology will be taught, skin related coverings, symptoms, materia medica will also be taught over the same case, over the same case. Although it is a first year, second year, third year part, थर्ड ईयर में तो ज्यादा रोल नहीं है, थेरेप्स का हो सकता है कुछ, एंड फाइनल ईयर मेडिसिन एंड थेरेपेटिक्स. एंड ऑर्गेनल वाला विल टीच दी माइजमेटिक्स साइड, posology side, its susceptibility side, so case taking side. So the same case may we are trying to make it more of practical way of learning. That is what is called as action learning, and which is very important. The another brainstorming thing that we wish to add, and of course it would go with the blessings of you kind of legends being with us, is that always pinched me a lot, that otherwise also I'm very much involved into education, how it is going and all, and it's my passion to work over the education. I happen to have our faculty who is a surgeon, who is a general surgeon, Dr. Suneet Sood, who is going to teach you surgery. He said, madam, when I teach surgery, आप बताइए, बोले मतलब मुझे ऐसा लगता था कि हो एटलीस्ट मेडिसिन का जो करिकुलम है विच इज वेरी अपडेटेड, up to the mark, up to the minute updated, and up to the time we are like teaching to the student, because with all the discoveries and everything. तो सबसे फंडामेंटली हिला देने वाली बात उन्होंने ये कही कि मैडम, हम लोग एनाटॉमी ग्रेस से पढ़ रहे हैं, फिजियोलॉजी गाइटन से पढ़ रहे हैं, पैथोलॉजी हैरिसन से पढ़ रहे हैं, एंड सॉरी मेडिसिन हैरिसन से पढ़ रहे हैं, एंड पैथोलॉजी रॉबिन्सन से पढ़ रहे हैं, सर्जरी लव एंड बेली से पढ़ रहे हैं. ये यूरोपियन ऑथर है, इन्होंने जो भी लिखा है उनकी अंडरस्टैंडिंग यूरोपियन रेस, एनवायरमेंट, कल्चर के साथ लिखी है. मुझे साइकोलॉजी से हमेशा प्रॉब्लम होता था, लेकिन ये बहुत बड़ा इशू है कि वी आर स्टडीइंग द बुक्स रिटन बाय द यूरोपियन ऑथर्स एंड ट्राइंग टू अप्लाई इन इंडिया. This is a fundamental shocker to the education. And I don't know how to work this out, but the solution we would try to seek through like venture like HomeoEd, with having people like you, that this is where we are actually going wrong. We are standing on the fundamentals of the Europe, the benchmark of Europe, and nothing doing with Indian. Very few authors have written something in Indian, and they are not very well or very obviously endorsed. और जो भी अगर है भी कुछ इंडियन फिजिशियंस ने ओरिजिन की बुक्स लिखी भी हुई हैं, तो वो नोट्स ही हैं, उन्हीं बुक्स के नोट्स है, गुटका बोलते हैं हम जिसको. सो वो नोट्स ही है. सो दिस इज समथिंग रियली सीरियस and fundamental vacuum in the education system. Let us see how we are going to work that out, and how we are going to work that out. Of course, we have joined, तो बात निकली है तो दूर तक जाएगी. We will evolve and grow together. So before concluding and giving my hearty thanks to taking out such a precious time, Dr. Jaswant sir, Dr. Gauravi, all the technical people available, and all the participants who were like, we shifted the platform altogether. So whatever the other platform received the crowd who is going to see this episode a bit later, we said that we'll ask you a question over this platform. I thanks everyone who has participated directly or indirectly in the evolution of this particular webinar. I would also say that there's a good news for all those who have contributed and those who have enlisted and registered for this particular webinar. We are going to offer flat 10,000 off incoming 48 hours for what all the courses that that is available in the application. Just you have to apply the code, you will receive all the information, and this is something, aim and aspire to go high. Just buckle your seats, stay with us, grow with us. And thank you so much. Thank you, everyone. Patil sir, thank you, thank you, thank you. Thank you.
Thank you so much.
Thank you so much.
Thank you so
Thank
much.
you, Gauri. Thank you.
So much. Yes.
Yeah, thank you, Rashmi. And what work you're doing is really good. I think the things what you have started, your mission and what your ideas are there. I really appreciate your hard work and that. It was difficult for me to join today, but I can't say no to you. That is my, because the work what you are doing, and I have to encourage all those who are working for homeopathy that we must take homeopathy ahead. That should be our motion. Thank you.
Yes.
Bye bye.
Thank you. Thank you
Thank
so
you.
much.
Thank you. Good night for Gauri and
Yeah.
good morning all
Have a
again.
good night, Gauri, and have a good day to everyone.
Sure. Okay then.
Thank you.